Yeah, if you ever have a well seasoned nurse telling you, are you sure you want to do that? You should probably stop and think and reflect and maybe not do that.
Definitely. All right. So, what are three most common mistakes when it comes to giving pre meds and choosing pre meds?
I would say the first one being is choosing the same protocol for every patient, no matter their comorbidity, their disease, their age. You may find that you are picking similar drugs for most of your patients, but you should always take everything into consideration.
And what is the second most common mistakes when it comes to choosing pre med?
I guess forgetting or not recognizing some of the patient's comorbidities and what can happen. So if you are using, let's say, an opioid with alfaxone, just remembering that if your patient, as we talked about earlier, is obese, then they're going to be more prone to not breathing as well, or what we would call hypoventilating.
And what is the third most common mistake when it comes to choosing pre med?
Not planning for analgesia appropriately. So if you have a patient that's undergoing a TPLO and then you pre-med them with butorphanol, that's not ideal. You should be using a full mu agonist such as hydromorphone, methadone, or even fentanyl.
I feel like these are pretty basic mistakes, but do you still see that sort of in your day to day?
It can still happen from time to time, and so it's just always important that when these instances arise to have conversations about asking maybe why you picked this protocol or these types of drugs in this situation, and then recognizing how we could subsequently do better in the future.
I remember when I was a young little vet, there was a stitch up case, and I think I had buprenorphine or something. And I remember the nurse was like, "Are you really sure that you want to use this?" And I was like, "Oh shit!" And I don't know. I that was like really. It made me like I guess a little bit embarrassed, and I never made that mistake again. But
Yeah,
yeah, nurses do know too.
yeah. If you ever have a well seasoned nurse telling you, are you sure you want to do that? You should probably stop and think and reflect and maybe not do that.
Definitely.